Hello everyone. In this session, we will be discussing regarding an important topic, the relation between coccydynia and constipation. Important question which we will try to answer is, does tailbone pain cause constipation or does constipation cause tailbone pain? Before we try to answer this question, let us learn some basics. Let us understand some basics. In this picture, you will have to know what is rectum and what is coccyx. Pain emanating from the coccyx is called coccydynia. Coccyx is also called tailbone, and the pain from coccyx is known as a tailbone pain. So coccyx is also known as a tailbone. So pain arising from coccyx is known as a tailbone pain. See this picture. This is a vertebral column. This is a sacrum, and the tip of the vertebral column, which lies in between both your buttocks, is known as the tailbone. So this is the tailbone or the coccyx. And what is rectum? Rectum is the last part of our intestine. This is part of our intestine which carries our bowel, which carries our feces. So in this picture, this is the rectum. So this is the rectum. So you'll have to understand that the rectum, which carries our feces, is just in front of the coccyx or the tailbone. Now, let us come to the first part of the question. Does constipation cause coccydynia? See this picture. This is example. This picture shows the rectum which is filled with feces. Okay. So this is rectum which is filled with feces. This patient has constipation. So because of constipation, when the patient tries to pass feces, this is the direction of the pressure which he applies. So when you apply more pressure, this hard feces comes and will hit the tailbone. So this causes inflammation or injury to the tailbone. So this causes tailbone pain. So probably our first answer is clear. So does constipation cause tailbone pain? Answer is yes. Constipation causes tailbone pain. Let us come to the second part of the question. Does an abnormal coccyx cause constipation? See this picture of a patient who is suffering from tailbone pain and coccyx. The normal coccyx has a slight smooth curve, but in this patient, the coccyx is abnormally bent forward. This is known as an anteverted coccyx. That is, anteverted coccyx is a coccyx which is abnormally bent forward. And also, during passage of the bubble, the coccyx slightly moves forward and back. This is to accommodate the feces which is come. So if the coccyx is not mobile, even then it will obstruct the normal bubble movements. So the second part of the question, does an abnormal coccyx cause constipation? The answer is yes. So constipation causes coccydynia, and an abnormal coccyx also causes constipation. And what happens? This is very tricky. See, whenever there's a coccydynia, due to any cause, it causes reflex contraction of the perianal muscles. This is our rectum, which is carrying feces, and these are the perianal muscles. So any pain in the coccyx will cause reflex spasm of the perianal muscles. So this reflex spasm causes constriction of the rectum. This exacerbates constipation. That is, coccydynia due to any cause. Coccydynia because of any cause will exacerbate constipation, and this constipation will exacerbate coccydynia. So this creates a vicious circle. That is, coccydynia increasing constipation, constipation increasing coccydynia. This is a case which has been published in the literature. Let us see clearly. A 67-year-old male patient presented with a 2.5 year history of worsening rectal pain. Imagine 2.5 years. What is the pain? The pain develops an hour before defecation and lasts for several hours after defecation. Otherwise, everything was normal. He has some pain while he is sitting on a hard surface. The rectal pain, so of course he will go to a colorectal surgeon. All the investigations were normal. Then the patient had to happen to see an orthopedic surgeon. He has found that there was a palpation tenderness over the tip of the coccyx. All the other features were normal. Because there was pain on the coccyx, he has taken an MRI scan of the pelvis, which showed an abnormally forward bended coccyx. So let me see. So he has found this coccyx was abnormally bent, angulated forward, and this was indenting the rectum. So voila, he found the cause of constipation, and that constipation was because of an anteriorly angulated coccyx. So he underwent a standard coccydyectomy, which is a surgical treatment for coccydynia, in which we remove the abnormal coccyx and the patient was cured. So let us come to the conclusion. Constipation can cause coccydynia, and also an abnormal coccyx can cause constipation. So constipation can be a cause of coccydynia, and it can also be a result of coccydynia. But in either case, coccydynia leads to reflex spasm of the perianal muscles, exacerbating constipation. And this starts a vicious circle. So how do you treat? Should I treat constipation first or should I treat coccydynia? Where constipation is the cause or result, it needs to be treated. Either cause, you need to treat the patient. If constipation is the cause, you just give simple laxatives, high fiber diet, and encourage the patient to have an active daily life. It should relieve both the constipation and the tailbone pain. But if abnormal coccyx is the cause, we'll have to treat simultaneously the abnormal coccyx, which may be either manipulation or surgery, and also treat the constipation with laxatives to break the vicious circle. So, hope I made it clear. Is constipation the cause of coccydynia or coccydynia the cause of constipation? If you have any further doubts, you can leave a message in the comment section or you can take an appointment over the number which is scrolling down. And I'm Dr. Kalyan. I'm a neurosurgeon and spine surgeon working in Aware Global Gynecology Hospital, Hyderabad. If any of your relatives or friends or colleagues are suffering from tailbone pain, do share this video with them. It may be useful to them. Do subscribe to my channel. Thank you.